Hey everyone, welcome to the Live Well, Love Strong podcast. Today I have a very exciting guest, Dr. Paul Harch. Dr. Paul Harch is an emergency medicine and hyperbaric medicine clinician. He's a clinical professor of medicine, section of emergency medicine at LSU School of Medicine in New Orleans, and the former director of University Medical Center Hyperbaric Medicine Department and LSU, go Tigers, Hyperbaric Medicine Fellowship. He has a very long bio, and we're going to post it in the show notes. But I just want you guys to know that this man is the best in his field. And before I let him start talking, because he's going to have a lot of really great things to say, I just wanted y'all to know that we know, our family, Mary Elizabeth and I know Dr. Harch personally. We discovered him when Mary Elizabeth, before she turned 1, and we went to his Harch Hyperbaric Oxygen Clinic when he was still in, you were in Gretna, right? In New Orleans?
In Marrero, actually.
In Marrero.
Right.
And so we went and did 88 dives with Dr. Harch before we purchased our own hyperbaric oxygen chamber. And then with Dr. Harch's expertise and guidance, we have continued to dive with Mary Elizabeth. And so this is very personal for me. It's very close to my heart. And he has a lot of really great information and is doing some really awesome things for our community. So welcome, Dr. Harch, and thank you so much for coming on with us.
Thank you. My pleasure to be here.
Awesome. Awesome. Okay, so let's just hop right into it. What is hyperbaric oxygen therapy?
It's the use of greater than atmospheric pressure and oxygen to treat diseases. And actually, what we're treating are the underlying disease processes that are common to so many diseases, which is why it's applicable to so many diseases. But if you look at the 363-year history of this field, it's found success primarily treating wounding and inflammatory conditions. And everybody thinks of an external wound as a wounding condition, but so many of our internal conditions are also wounding conditions: stroke, traumatic brain injury, a birth injury, cerebral palsy, hypoxic ischemic encephalopathy, etc.
Yeah.
So it's treatment essentially for wounding and inflammatory conditions anywhere in the body and of any duration: acute, medium range time, and long term.
Oh, I love that. Okay. All right. So how did you get into treating pediatric brain injuries, Doc?
Oh boy. A little bit of serendipity. We made a discovery treating our divers with brain decompression illness. We have the diving practice here in New Orleans, and we see divers from the Central Gulf of Mexico and South Central United States. And I was very interested in what was going on in their brains because the Navy, US Navy, doesn't really spend much time talking about it. Long story short, we found that we could treat these divers long after their injury. And right as we were making this discovery, a little boy from New Orleans drowned on vacation in Florida. And one of the doctors who became my mentors had a hyperbaric facility there in South Florida and treated this little boy. And when the family, he was stable enough, et cetera, to bring home, they brought him home and we got a phone call. Could you guys continue treating this little boy? And we said, okay, we would. And that was really the first pediatric patient that we treated outside the hospital indications, like acute carbon monoxide poisoning.
Right. Right.
But what happened was that little child and the divers launched this whole program and investigation where we realized that, wait a minute, if we can treat divers with this delayed injury, what other chronic brain injury would be responsive? And so in the process of this, clinical investigation, if you will, or just pursuit in my practice, we had a director of research who was a professor of biology at University of South Alabama in Mobile, Alabama. And he went to a cerebral palsy support group meeting and stood up and said, I have a treatment for your children. And of course, these mothers and parents were just beside themselves. Next day, he called me up and he said, you're going to be getting a call from some parents to treat their children with cerebral palsy. And I just about went ape with him because number one, he was a PhD. He had nothing to lose. I was the one
Right.
who was going to have to treat these children. And I asked him, I said, Shelley, what do you know about CP? He said, nothing. I said, what do I know about CP? I had one child during my pediatric rotation in medical school with CP. That's it. And then I stopped dead and realized, wait a minute, how did we get onto this and treatment of other patients? What is different about CP? Nothing. It's a wound. It's a wound in the brain. So I said, okay, fine. I'll talk to whoever calls. And this mother called. 4.5-year-old boy, birth injury, CP, hypotonic, just a little floppy kid who sat
Yeah.
there, drooled, couldn't eat. And in 80 treatments, we had this little guy walking with fingertip support for balance. Had never walked in his life. He had stopped drooling, was able to eat more. And it was like, look what happened here. And
Yeah. It's
that is
amazing.
how this all began.
Oh, I love it. And that's how we found you. And one of the things that I want to talk about before we dive into some of the research you're working on right now is the concept of idling neurons. It's one of the things that I kind of stuck to when we first had the conversation because Mary Elizabeth's brain injury happened in utero. So months and months and months and months and months before we found you. So if the injury is old, and you had said that originally when you were talking about it, it can treat acute things, it can treat things that are happening right now, and maybe
Yeah.
old stuff. So, what is the concept of idling neurons? What does that even mean?
It means that brain cells don't have to be dead or fully alive and functional. They can be in an injured state. And this was described by that doctor I mentioned, my mentor, one of my mentors, Dr. Richard Neubauer, where he had been treating neurological disease for 15 years with hyperbaric oxygen. And he had a 60-year-old lady, 14 years post-stroke. And they were able to show with brain blood flow imaging the huge stroke. Next day, put her in the chamber, took her out, and repeated the scan. Right in the middle of the dead area, seemingly dead area, it lit up with metabolic function. It means there were living brain cells there that were not working well. It turns out that area of the brain was the area that controlled facial motor and oral motor. And this woman, over the course of 16 months, reacquired speech, stopped drooling, could swallow, eat, and they were able to get her up and assist her with ambulation. And the title of the article, that it was a single case report in a world famous journal was The Idling Neuron, meaning what we've been taught in neurology. Brain cells are dead or they're alive, and that's all there is to it, functioning alive.
Right.
There could be this intermediate state. And yet this was known for heart muscle, damaged heart muscle, and for other areas in the body, but not the brain. The brain was different. And
Yeah.
this just shattered that whole idea. That is the concept. So with any injury, there are areas that can be so severely injured that the cells will die.
Mhm.
And of course, when there's an injury, the blood vessels leak in the area that's called inflammation. And that fluid that leaks out compresses the surrounding blood flow, tiny blood vessels. And when it does, the oxygen level and blood flow level drops. When it gets to a certain point, those cells get put into this kind of frozen, idling neuron state. And they can exist for years and years and years and years. And what is happening is hyperbaric oxygen is waking them up. So with CP, with traumatic brain injury, with stroke, with HIE, with all sorts of different neurological conditions, we have a proportion of the injury that are these idling neurons. And that is part of what hyperbaric oxygen is targeting.
Oh my God, I love it. I love it. Okay. Can we talk about some things that you're currently working on for our
Sure.
kids?
Well, a couple of things. The number one thing I'm trying to do is get hyperbaric oxygen reimbursed for cerebral palsy children.
Yeah.
And we can talk about that in detail. The other one is we raised money and I'm hiring. Boy, this has taken so long and stuttered along. But we're doing a retrospective review of the over 160 drowned children that I have treated. And we want to show that you can recover function in these children that everybody just considers there is no hope for. Um,
Right.
and so those are the two big projects. The CP one, after that initial child that I treated and a whole series of others, um, the word got out. Other centers started doing this. And finally, in Canada, they did a few studies. And the interpretation of them was very complicated. But what has happened now, the primary doctor up there involved with those studies has developed a new method to evaluate there's a measure called the gross motor functional measures that measures the CP, the
Right.
motor function in these children. And all studies that of merit that are trying to see what the effect will be on motor function do the GMFM.
Hmm.
He has now found a way to take any child's GMFM at any age and be able to predict with, I don't know, like 99.9% accuracy what that child's motor function will be in a year, 2 years, 5 years. And what it's allowed to do is to take all the studies that have been done on CP kids, different therapies,
Hmm.
look at the GMFM and compare them. And what he has found is that hyperbaric oxygen is 4 times as effective as the average of all these other therapies. The
Yeah.
closest one is horseback riding at 40% as effective as hyperbaric oxygen. But stem cells, Botox, dorsal rhizotomy, physical therapy, intensive PT, and extremely intensive PT, all of them are far less.
Yeah.
This article, I begged him to do this. I had a research topic in Frontiers in Neurology, and we invited articles, and I really begged him to write this one because he'd been showing it at conferences. It's now published. And the significance of it is that now parents can get hyperbaric oxygen reimbursed for the
Yes.
children because of the level of evidence. But I want this more officially and formally done. And so
Right.
that's what I'm working on with the government.
Okay. So Dr. Harch is working on y'all getting Medicaid and insurance companies to reimburse hyperbaric oxygen therapy for kids with cerebral palsy and other brain injuries. And so you have been successful in how many states? We talked about this a little bit, and I just want to give the mom some hope.
Okay, that isn't my effort. I'm only a part of that. But there's a father, David Friels, in Atlanta, Georgia, whose son Jimmy. All of this is public, and he's given me permission, of course, to talk about it whenever. Uh, his child got hyperbaric oxygen for CP, and he was a severe quadriplegic CP. And this child's speech, motor function, just the improvement in him cognitively was so dramatic, and it was captured on brain blood flow imaging. He took Georgia Medicaid to court and finally forced Georgia Medicaid to pay for it based on the actual Medicaid law, which says that it will reimburse for medically necessary treatments or treatments that correct or ameliorate. And what he showed was this corrected or ameliorated. There are now, I think, 25 states that have, or parents that have followed his lead, taken that legal template and forced Medicaid to pay for cerebral palsy in their children. It's a fight still because it's
Right.
not on the list, but parents of injured children have a lot of fight in them. And
I was about to say we can do it anything. And if we have a little bit
yes,
of hope and a little bit of support and some really smart people behind us,
yes.
we can do it. So that's really promising, guys. And that's something that we can do on our own and also help David and Jimmy and the rest of the people that are really working towards this.
And go to his website, medicaidforhbot.com.
Okay.
And I
Medicaid for
believe it's still active.
HBOT.com.
Yeah.
Okay.
David's
Awesome.
been sick recently, but yeah, I think it's still active.
Okay. All right. Can we discuss the research that's sitting on your desk right now that you and I talked about a little bit before? Can we talk about that for a minute?
Which one is that? The
MRI images pre and years.
Oh, yes. Okay. Well, when we started this, we were indexing the abnormalities in someone's brain, child or adult, to brain blood flow imaging based on what my mentor, Dr. Neubauer, had done with that lady post-stroke. And it was the only way to try to capture it. He had never on CT or MRI been able to show the changes that occur, excuse me, before or afterwards. So I routinely never ordered them. But what's happened is over the years, children that I haven't treated and children that I have treated, of course, have CTs and MRIs before they come for treatment. And after their improvement, their neurologist, wow, this child is different. Well, we're going to see, we'll reorder a CT or MRI. And what they've done is been able to capture growth of brain tissue. I was able to do that in one, besides with Mary Elizabeth, we were able to do that with that little drowned girl from Fayetteville, Arkansas.
Right.
And that's what the whole article was about. And that's why the thing went worldwide. The publication, LSU got behind it, press release, all that stuff. We were all on television. And what we showed was a global regrowth of her brain as a result of her treatment. And so I've got a series of patients that just, serendipitously have had a reorder of a CT or MRI, and it's shown this improvement. So I'm in the process, we are hiring a full-time research assistant, and that person and myself are going to go back through all of the years of imaging and find the cases.
It's amazing. I love that. I feel like when we first talked about it, Mary Elizabeth was already getting the imaging, and we had seen so many positive things with her. And I think you remember when we came to you, she was cortically blind. Her pupils didn't react to light. She had zero activity on any SPECT imaging or any kind of, monitoring in the occipital lobe, which is where you process vision. And now today she's 14, she uses an eye gaze technology system to communicate. And we knew that we were seeing what I would call tiny miracles. I mean, they were big miracles, but I try not to I try to keep expectations under control for mamas, because I know how our hearts work. So, we were seeing these tiny miracles along the way. And it wasn't until probably 4 or 5 years later that we repeated the MRI that I was like, hey, maybe Dr. Harch should look at this. And indeed, Mary Elizabeth has grown new neural tissue from those idling neurons, right? Is that where it's come from?
Well, it's from that and even surrounding tissue. We now know hyperbaric oxygen has all sorts of effects on stem cells. And it also stimulates those damaged tissues to sprout and potentially even multiply. But you raise a good point about this cortically blind. I just wanted to touch on that because that is one of the most frequent assessments that are made by physicians on acutely injured children.
Right.
Oh, they're cortically blind.
They call us cortically blind, or they say we have cortical vision impairment, which, right.
Okay, but I'm talking about actually blind.
Right.
Can't see anything, meaning the visual cortex is dead, gone.
Right.
I will tell you, it's one of the 10 things I tell parents who have children with HIE or CP before they come here, that overall there's about a 90% response of these children to hyperbaric oxygen. 10% will not respond. Usually they're the absolute most injured, tracheostomy, seizure disorders, rigid, fixed stare, unreactive pupils, unresponsive, just very, very severe. But the other 90%, if they have cortical vision impairment or are cortically blind, we see improvement in vision in every single one of these children.
It's amazing.
Every one. There's not a one that I can think of that has not had demonstrable return of vision. So we just ignore that. And I tell the parents, please ignore that. Your child is very likely not cortically blind.
Yeah, I love that. That's very hopeful. Yeah, very hopeful. Okay, so what are some of the barriers to getting this out, to the validation of the research. Like, I've seen it with my own eyes, other moms have seen it with their own eyes, you've seen it, other really important, smart people have seen it. So what's the opposition?
There are many, but there is good news at the end. The doctors are the biggest obstruction.
Yeah.
Because my generation of doctors, I was taught in medical school that this was a unscientific therapy, thoroughly disproven, and as I quote in my book, charlatanism, snake oil sales, and fraud.
Yeah.
And that's what my junior resident taught me. And so my generation of doctors has written off this therapy. And the reason is it was never able to be understood, defined, and explained to doctors. And doctors, boy, if they don't understand some therapy, they will not refer patients for it.
Yeah.
And plus, the studies that have been done have had conflicting results, a lot of them due to design problems. But it's essentially been written off. So the doctors are one problem, getting them to accept it. Number two, specifically, are the neurologists, because the neurologists have taught us, and this was when I was in medical school. It's why so few of us went into neurology. You rotate onto neurology, and they tell you we have no treatment for anything except myasthenia gravis, which is that autoimmune, muscle nerve disorder.
Right. Yeah.
And the treatment was an injectable drug you had to give every hour, 24 hours a day, 365 days a year for the rest of the patient's life. Essentially, there was no treatment for anything. And so here we are showing you can treat brain injury, chronic brain injury, which was untreatable. And there is extensive pushback. Specifically for CP, it's in the neurology community because the way the studies were done. And in the one big study, they accidentally, the control group, they gave a lower dose of hyperbaric therapy that they thought and believed would be inactive. And lo and behold, it was as active, if not more, than the pure oxygen dose. And nobody understood that science because of the way it had been defined. Funding is another obstruction. There is no deep pockets person like a drug company that can fund hyperbaric oxygen studies because they can't protect it with a patent. It's unpatentable. So there's been no funding source except the National Institutes of Health. And the chamber manufacturers are by and large small companies that do not have research budgets. They got marketing budgets, but they don't have research. And the FDA, of course, is the last one. To get something cleared for marketing, meaning a new indication, FDA approved new indication for hyperbaric oxygen, is a laborious, extremely extensive process. And to give you an example, for traumatic brain injury, when I went to the FDA to get my investigational new drug exemption to do the study, I proposed what we were going to do, treating veterans at one dose of hyperbaric oxygen. They said, no, look, you got to do a whole series of studies with different pressure and oxygen levels. We're talking $25 million and 10 to 20 years of studies. So that's the last one. But the good news is we now have an advocate, a proponent of hyperbaric oxygen therapy in the federal government at the highest level of the healthcare system.
Let's talk about it.
Secretary of Health and Human Services, RFK Jr.
Yeah.
And he is setting in motion now, after his prediction the day after the election, that hyperbaric oxygen is going to be one of his prioritized therapies.
So that's hopeful. And we have
very hopeful
to be excited about. Okay.
Very excited. I can even give you more detail, but I got to be very careful about it.
No, I think that's enough, and that's exciting. I want to talk next about what does a mom like me who has this baby, that definitely has a brain injury, how do we go about seeking treatment in hyperbaric oxygen, and what have you learned about how to treat our kids that's kind of different than when maybe we first met you?
Well, the number one thing is that they are responsive in a lower dosing range than what we typically thought.
Yeah.
Um, and that's reproducible.
Hmm.
And most of those doses, or a good amount of it, can be achieved uh, in a portable chamber. But the other problem is you have to be careful, especially with seizure disorders and just with overall sensitivity. And you can give too much of this, and you can hurt people. And so when people are seeking therapy, you need to treat it like you do any other. I know I hate to put it in this category, but almost consumer item.
Right.
Oh, you're shopping for a car. What do? You learn all about the different models. You go in, you go to a dealer, you talk to them, you look at the thing, you talk to friends and so on. With a medical therapy, you have to do the exact same thing.
Hmm.
You've got to go in and find out who is delivering this thing. What's
Hmm.
happened now, because there is no oversight of this therapy,
That's
even
what I was about to ask that. Okay, keep
it's a
going. Sorry.
formal medical specialty. There is no oversight of this to the extent that anybody can get a chamber, open up a clinic, hang a shingle, you can declare whatever you're going to do, and
Hmm.
put that chamber in and start treating people. You don't have to have a doctor. Well, you do, but it's not enforced at this point. So
Yeah.
you've got massage therapists doing
Right.
hyperbaric medicine. You've got businessmen. You've got people who know nothing about it, uh, it, and people like look at the recent accident up in Michigan.
Hmm.
This is a mother with a PhD who made a business out of it.
Yeah.
And, anyways, in a terrible accident. So
Yeah.
you have to do like you do with any other therapy in medicine. You got to do your homework. You got
Yeah.
to talk to other people. And of course, now with social media, this online, there's nowhere to hide. It's
Hmm.
so transparent and information is shared and so on. And
Yeah.
you can find out about people, but go in and talk to the whoever the person is there that's going to be given the therapy.
Yeah, I like it. Okay, so do some research, find some
Yes.
doctors, find some places, go in physically, check it out yourself, ask
Yes.
lots of questions. My memory was, and we've done all sorts of stuff with Mary Elizabeth and a lot of alternative stuff. It felt very medical to me. Like it was a serious thing, right? Like we went into your clinic, we had very strict precautions on what we could wear and what we couldn't wear, what we could have, what we couldn't have, how we handled ourselves. Like everything was very, very serious. So I think that you want to find a place that is taking this as seriously um, as Dr. Harch is and some of the other leaders in the area.
The FDA classifies hyperbaric chambers as a significant risk medical
Right.
device.
Yeah.
Can hurt people in it.
Right.
And what happened, just a little aside here, as I was doing this and presenting it at conferences and scientific meetings and so on, and the word got out, others started doing it. I started getting phone calls from
Hmm.
parents. We took my child and got hyperbaric treatment, like you said, and now my child's like this and had a bad outcome or something negative happened. And,
Hmm.
I sat down, took notes and all of that. In 2001, I published all of these cases in a book chapter. A good number of them were our cases when we were doing formal dosing studies, where you're trying to find out how much can
Right.
you give, how little, what works. I
Right.
mean, formally looking at this. But the other half were people who had just been kind of indiscriminately treated. Well, that
Hmm.
book is out of print now. Nobody can get it. I mean, you
Hmm.
might be able to scrounge up a used copy, but last year I published an article expanded on,
Hmm.
and in there are the deaths of two children whose parents killed them in the chambers that like we have. And
Hmm.
I documented all 60 cases, and you can go find it online. Harch, oxygen toxicity, frontiers in neurology.
And I'm
But
gonna post it in the show notes for the moms that are listening. Okay.
yes. And so, yeah, and what it did was show that when we started this, it was assumed and it was dogma in hyperbaric medicine. You could not hurt anybody with this therapy under
Yeah.
2 atmospheres of pure oxygen. And it was wrong. And
Yeah.
that's what I was showing, is that people can get into trouble with it.
Yeah, that's good to know. And I'll just say, as a side note to moms, this is my, like, obviously our experience and anecdotal, but we did have to battle seizure stuff, right? So like as her brain started, as those neurons started working again and being reoxygenated and coming to life, you have more activity, and then you're going to have more misfires. And in my mind, those are seizures, right? And so we do, you have to be very smart and aware, and
Yes.
keep your finger on your kid, the whole kid, not just very specific things, the way that I think mainstream medicine kind of like looks at each specialty, right? So we're looking at GI, we're looking at neuro, we're looking at
Right.
endocrinology, whereas for this, the oxygen is affecting every system in our experience. And so you
It
have to
is.
really be on the lookout for any slight change in your kid when you're
Yes.
starting this kind of thing.
It's a drug. It's
Right.
like dosing any drug, but it's an unusual one.
Right.
And the symptoms of too much have never been recognized in treating chronic neurological injury. And that's what that article was about, was to say to people, look, when you dose this, if you
Mhm.
start seeing this, you have to stop and,
Right.
and redose, drop down, et cetera. Give a break.
Yeah. Yeah. I like it. Okay. All right. I heard there's a documentary coming out about hyperbaric
Yes.
oxygen. What, when, where, how do we watch?
It's called Undeniable Evidence, Clean Medicine, Dirty Politics.
Ooh, I like it.
And it's essentially the story about, it's kind of a biopic in a way about me and this struggle to prove that hyperbaric oxygen worked for chronic traumatic brain injury, and in particular in veterans. And the focus of it is the suicide epidemic in veterans,
Mhm.
which is now recognized and an issue in Great Britain, Australia, Canada, and the United States.
Yeah.
Um, and what it goes through is how the evidence really for effectiveness of hyperbaric oxygen for this condition and PTSD is undeniable, but it's not reimbursed and it's not being applied. And why? And it identifies the government and
I
various.
like it. It's perfect timing. It's perfect
Yeah,
timing. So can people watch this right now, or will it be available later?
not yet. It's been submitted to 40 national and international film festivals.
Okay.
And we're going to have to wait. There's going to be a trailer put out on it very soon, probably within the next week. And I'll
Okay.
get you that. You can go watch it. We're
Okay.
not sure of the final date when we can release it, because if you do, it compromises being in these film competitions.
Yeah, that makes sense. Okay. That is
I'll
so
get you the
exciting.
trailer.
Yeah, I'm very, very excited to that. Okay. So what can we do as moms? Like, what's the call to action for us? You are working very hard. Um, Jimmy's dad, David, is already working very hard. We have other
Yes.
doctors and other leaders in your field that are working hard to legitimize this, to get mainstream medical behind it, to get Medicaid payment, to get people to respect it as the treatment that as a medical treatment that it is. What can we do? We talk a lot on this podcast, Dr. Harch, about if we want something as moms, we have to build it ourselves. We have to do it ourselves. Like,
That's true.
we have to act. So what is our action moves? What can we do to support you and to support this therapeutic practice for our kids
Well,
and for
you
the
need to
ones to come?
organize. Yes, you need to organize. Your power
Organize.
is in numbers. Bringing all of the pediatric neurology community, the lay community into this. And look at the model of MAD, Mothers Against Drunk Drivers, and what they did.
Okay.
You have incredible power. And when I early got into this. I was amazed at the work that my mentor had done, and it hadn't been adopted. And there are a lot of reasons for that, but the big part of it is this is a battle that has to be fought on many fronts. I'm doing the clinical work, and we're doing the science. We're trying to, go through the academic community and that route. But we realized, I mean, I've done all sorts of publicity that we could, articles and
Yeah.
radio and television and you name it. And you need to do the same thing. But you also need to do what we did, which is go to Congress. And I want you to be aware of what's been done with veterans now with traumatic brain injury and PTSD. They have organized, a group has organized, and it's called Treat Now. And they have essentially spearheaded, I think it is 17 states have passed legislation authorizing treatment of veterans with hyperbaric oxygen who have traumatic brain injury and PTSD. And I'm going to say about half of them have actually funded it with money to treat them.
Wow. Okay.
And this is something that needs to be done. And now you've got the evidence, especially in CP. But
Yeah.
HIE is not, I mean, it's different a little, but still the principles are the same of how hyperbaric oxygen works. And so it's Congress and every way you can possible
Yeah.
to bring attention to this problem. And you should say that the basis of it is there is now unequivocal published evidence that
Right.
this is an effective therapy for cerebral palsy, and disseminate that article.
Okay. All right. And then we have to organize, which means we are going to have what I think are local groups,
Yes,
where we're meeting together, where we're doing
yes.
this in numbers, like Dr. Harch said. And so that's a call to the mamas listening. If you have benefited from hyperbaric oxygen therapy, or you would like to benefit from it with your kid, this is your responsibility. This is not someone else's.
And support RFK Jr. in what he is doing. Put
Okay.
aside any politics, any feelings you may have about him or vaccines or anything else. I'm going to read you. Did I do this earlier? Did I read you the tweet that he sent out the day after the presidential election?
I don't know if you
Do
read
we
it
have
or not, but
time?
we talked about that for a minute, and I think it's important. And I think that yeah, he is a key factor in power, in control, that can move the needle for this particular thing. Yeah.
Well, I want to read to you what he sent out on November 6th. The FDA's war on public health is about to end. This includes its aggressive suppression of psychedelics, peptides, stem cells, raw milk, hyperbaric therapies, chelating compounds, ivermectin, hydroxychloroquine, vitamins, clean foods, sunshine, exercise, nutraceuticals, and anything else that advances human health and can't be patented by pharma. If you work for the FDA and are part of this corrupt system, I have two messages for you. Number one, preserve your records. And number two, pack your bags.
Yeah.
Now, what happened after that is I was asked to submit a recommendation and plan on how hyperbaric oxygen could be advanced and he could make an impact with this. And this is now progressed along. My two priorities are to get hyperbaric oxygen reimbursed to start with for traumatic brain injury and PTSD and for cerebral palsy children. And
Okay.
so there's going to be more information coming out very shortly about his plans, but he is going to make good on what he said in that little tweet, and it's happening. And
Good.
so, in fact, this weekend I have to get in a certain recommendation and little agenda plan. But those are my top priorities. So, and
Yeah.
he is going to help. So
Okay. I love
please
that.
support him.
Yeah. Okay. We are going to support that. And I'll say everything that he put in that tweet is everything that has helped and worked for Mary Elizabeth, in addition to a lot of mainstream medical stuff.
Yes.
And so,
Sure.
we should be pursuing and using every resource and every amount of wisdom and experience that we have. There's no reason not to be doing that. And so,
Exactly right. Hyperbaric oxygen is not the cure. It's not the one answer. It is
right.
a foundation biological therapy, but it also works good when it is combined with other things. So
Yeah.
you repair the brain with hyperbaric oxygen, and then we add all these enrichment therapies while you
Yeah.
continue to do the hyperbarics.
Yeah, I love that. And we follow that model. And with Mary Elizabeth, we, initially combined stem cells and hyperbaric oxygen. And we still use hyperbaric oxygen in conjunction with a stem cell therapy every single time. And we have
Yes.
tweaked our protocol a little bit with some of your extra research whenever you said, hey, lower pressures are, working better or giving us better results. And we see the move forward with it every time. And so hopefully everyone will have access to it with the insurance and the Medicaid paying for it and legitimizing it as a therapy. So
And
um,
new therapies are going to come along that are going to take all of this to another level.
right, yeah. We're really into frequency therapy these days, and so I can't wait to see what grows with that in the next 5, 10 years, because yeah, I mean, I feel like we have so much at our disposal to use, and so hopefully we can start kind of tapping into that, and then the
Yes.
rest of the community, the medical community, will see it and hopefully, yeah, start talking about it as well with their patients. So, um, okay, Dr. Harch, I have loved spending this time with you. I've loved connecting and just catching up. I'm so proud of you, and I'm so happy to have you as someone who's fighting for our kids. And guys on the podcast, if y'all don't know, Dr. Harch is like y'all, he's famous. He's a genius. He's brilliant. He knows all the things. But what I remembered about him and what I told him is just how much his wife and he, Juliet, just loved on us and made us feel like everything was going to be okay when we really didn't even know. And so he has a heart for compassion and empathy and kindness, and he's doing this um, for the right reasons. And like I can't say enough about what a good man this person is. And so thank you for coming on. Thank you for everything you do for our kids and for the veterans and for everyone else who you are touching with your research and with your wisdom and your experience. Is there anything
Well,
that you want to leave us with? A final thought, final call to action, anything?
well, I am extremely optimistic. This has been a very long 40 years
Yeah,
of fighting.
yeah,
And I just know we are coming to a new awakening here in many ways. And so I'm just, in fact, there's more to come. I'm not going to stop until we get this past the finish line.
yeah. Awesome. Yeah. All right. Thank you. So guys, we have him on our team and he's a force of power. So thank you so much, Dr. Harch. We are going to post all of the websites and links for different things. When he gets the trailer for the film festival, that will be all over our website, y'all. And let's get together and let's start organizing. Go ahead.
And let me know what I can do to help you. Okay.
Yeah, I definitely. I would like to collaborate on things so that way your
Sure.
audience and the medical community that's already kind of watching you is also listening. I feel like I don't know if people care about kids like mine other than us and the people that love us. But I think, it's the only way for this kind of movement to happen is grassroots, and
Sure.
affect one person who affects another person who affects another person. And then the ripple creates a wave, and then we're moving forward.
True. It's one person at a time. Do you have a nonprofit?
We do. Yeah. Live Well,
Good.
Long, Strong is a nonprofit.
Oh, okay, because we do also. And it was mine for years. I've handed it over now to an independent board. But I wanted to make you aware, if you're not, of Team Luke Hope for Minds in Austin, Texas. And
Okay.
every year they put on a conference and resource fair for parents of children with acquired brain injury.
Wow. Okay.
Cerebral palsy is acquired brain injury this year in September. Given that every year, give a talk there. It's going to be on children with cerebral palsy.
Love it. Okay. All
And
right. So that's
hyperbaric
something
oxygen.
else we can look forward to. And then we can
It's a
support
resource
these
for parents.
things, right? It's a resource. And then also if you're just listening to this because you love someone in our community, these are organizations and people to support and get behind that are doing really good work where it's making a difference in our community. So
Yes, they
thank you
are.
so much, Dr. Harch. We
My
just like
pleasure.
just
This
love
is
you.
great.
We love you and Juliet. So we're grateful to have met you and
My wife's a
appreciate.
saint.
Yeah, she really
She
is.
is a saint. She's just
Yeah,
incredible. Yeah,
yeah,
I'll
she's
tell her you
amazing.
mentioned her. Yeah.
Thank you
All
so
right.
much, and thank you for
My
your
pleasure.
time. And we're going to keep following you and supporting you and cheering for you. So thank you.